Hi, I'm Amanda Massey, and we're filming the reeval for our IP239 project. The group members are Kenny Barnett, Jacqueline Botts, Janae Zelaya, Amanda Massey, and Belle Collier. Okay, so we're going to start out. Kenny's going to be the patient. The patient came in before having problems with her right shoulder. So I'm gonna have you stand up for me.
Her right shoulder.
I need you to sit right there. Okay, so first I want to look for asymmetry in the muscles here, which there isn't any. Then we're gonna look for sulcus tests. She had a positive sulcus test, but today there's no positive sulcus test. Now we're gonna do full range of motion of the shoulder. Actively and passively. We're going to do it bilaterally, but Jacqueline's just going to demonstrate on one arm.
Okay, so I'm going to have my patient stand over here so we have a little more room. You can face that way for me. So we're working on the right shoulder. So for some, I would have them warm up 3 times. So you're going to go all the way through flexion and then all the way back and do that 3 times. Okay, and then with my inclinometer, place it on the forearm. Okay, and then have my patient maximally flex their shoulder. And it's a little past 180 degrees. And then I'd put it on 0 and then have patient extend. And it is at 70 degrees. And then I would have my patient abduct maximally, so they're going to keep their arm here, they're going to go all the way up, and they'd warm up there 3 times, and all the way in, all the way up, all the way in. Okay, and then I have my patient stay here. Okay, I'm going to have you raise it up just top of your head. Okay, and that's about 155 degrees, and then I'm going to have my patient bend over at the waist just a little bit, because it's a female, so, you know, you got to account for the
breast tissue.
She's okay. Okay, go in as far as you can. And that's about 50 degrees. Okay, and then I would do internal and external rotation. I'm going to have my patient bend the arm here. I want you to externally rotate as far as you can, and then internally rotate as far as you can. And do that 2 more times. Okay. Okay, and have them externally rotate and try not to put too much motion through the shoulder here. There we go, that's good. All right, so 100 degrees. Okay, and then internally rotate. Okay, that's about 85 degrees there. And the normal values are going to be,
well, the normal are going to be 180 for flexion, 50 for extension, 180 for abduction, 50 for adduction, 90 for internal rotation, and 90 for external rotation. And we found that the patient had excessive mobility in active and passive range of motion. So the next thing we're going to do is the muscle test. So Kenny, lay face up for me.
Kenya.
Okay. First, we're just going to do all the muscle tests throughout all the planes of motion. So I'm going to have you flex your shoulder as much as you can right here, and then don't let me push it down, okay? So hold. Okay, good. And then we're going to extend, and don't let me push down. Good. Okay. And then I'm going to have you abduct here, and don't let me push to the side. Okay, good. And then eat across your body, don't let me pull out. Good. And then we're going to have internal and external rotation. So go Popeye on me. Okay. Don't let me push your arm back. Okay. And then don't let me pull it up. Actually, if I was doing that better, I would be stabilizing the shoulder while doing these muscle tests. Something we want to add to the exam, just to be more specific, is Heron's extremity protocol. So this is going to be internally rotate here, and don't let me pull your arm out. And that's testing for the SC joint dysfunction. And then I'm going to push in, don't let me push in. Okay, and that's testing for the clavicle. I'm going to have you hold here, thumb point in, don't let me pull out. Okay, and that's first rib. So put your arm right here, hold in that position, don't let me push down. Okay, that's the anterior humerus. So hold here, don't let me pull out. That's for the latissimus dorsi or thoracic subluxation. We need to hold here, don't let me push down. That's for AC joint. Here, don't let me pull up. Posterior humerus. And then, I think that's it. So that's a more specific way to see if there is a segmental dysfunction component to the shoulder. You put your arm down. Some of the ortho tests we're going to do, so maybe sit up, are going to be Neers and Hawkins-Kennedy test.
You want to swing around this way? Okay, for Neers test, you'd start with the patient's arm supinated or externally rotated, and you're gonna I'm gonna passively, don't resist me, I'm gonna bring it through its full range of motion here. Okay, and then I'm gonna internally rotate or pronate the arm, and I'm gonna go back through the passive range of motion here. And if there was pain with external rotation, that'd be supraspinatus impingement, and if there's pain with internally rotated, then that would be biceps brachii impingement. And then now for Kennedy Hawkins, I'm gonna come here, start with the arm abducted and externally rotated, and I'm gonna bring it down into internal rotation. And what I'm feeling for is there would be pain in the anterior lateral aspect of the shoulder, indicating a supraspinatus impingement.
Okay, and that's what we would do for reevaluation to follow up with the patient.